So human disease development is affected by several major factors, including your genetic background, your lifestyle factor, as well as environmental exposure. Among all the diseases regularly reported to WHO, 80% of those diseases are affected by environmental factor. It accounts for 24% of global disease burden, and even more among children, that's 36%. In terms of premature deaths, environmental factor accounts for 23% of all premature deaths. For example, air pollution is the largest environmental risk factor and causes about 7 million deaths each year. So there are several major challenges in dealing with environmental issue. The number one is environmental issues always ongoing and dynamic. While we have to deal with traditional environmental issues such as using the solid fuel for cooking, which is still very common in many of the country and in many of the low-income populations. And we also have to deal with those new emerging environmental issues such as using the new chemical in the house cleaning product. Secondly, it's always challenging to conduct environmental health related research, such as assess the personal exposure assessment has been very challenging in our research field. On the other hand, it's very difficult and challenging to conduct the intervention because many of the environmental issues are in the population level or in the community level, and many of those issues are politically sensitive, also related to economic development. So to address the environmental issue, I do believe that research plays a very critical role. Research is always the driver of the environmental policy change. So one of our missions in this institute is to conduct the cutting-edge research to help better understand how the environmental exposure affects human health. Secondly, our mission is to educate the public health workforce to help regulate the pollutant, build a healthy environment, as well as making the policy changes.